This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Eris, Senior Attending in Pediatric Neurosurgery.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the journal World Neurosurgery, published in 2026, titled Hydrocephalus-Associated Early Mortality in Myelomeningocele, a 22-year institutional experience.
This is a topic that hits home for anyone in our field. Myelomeningocele, or MMC, remains a cornerstone of pediatric neurosurgical practice, but as the authors of this paper point out, it is still associated with substantial early life morbidity and mortality.
Exactly. And while we've made incredible strides in prenatal and postnatal care, the authors highlight a specific gap in our literature. Although we know hydrocephalus frequently accompanies MMC, its specific relationship to early mortality hasn't always been clearly defined in these institutional cohorts.
Right. We often treat the hydrocephalus and the MMC as two parts of a whole, but this study really tries to tease out that relationship. They're looking at a single center experience over a 22-year period. That's a significant time frame. It spans multiple shifts in surgical technique and perioperative care.
It really does. The primary aim here was to describe early mortality patterns in these patients and to examine the association between three specific factors: hydrocephalus, shunt-related complications, and overall survival.
Let's dive into that early mortality aspect. In the context of MMC, we're often looking at the first few years of life as the most critical window. When the paper talks about early mortality patterns, what are we really looking at?
The study focuses on how these patients fare in those initial stages. The authors emphasize that the relationship between the hydrocephalus itself and the survival of the patient is incompletely defined. By looking at 22 years of data, they're attempting to show how much of that mortality is tied directly to the neurological complications of hydrocephalus versus other systemic issues.
And one of the most critical variables they discuss is shunt-related complications. For a resident listening, we know that the shunt is often the Achilles heel of neurosurgery.
Definitely. The abstract notes that they specifically examined how these shunt complications impact survival. In the cohort, because hydrocephalus is so prevalent in the MMC population, the management of that intracranial pressure becomes a dominant factor in their clinical course.
It's interesting because, as a senior attending, I've seen how our approach to shunting has evolved, but the fundamental risk remains. If a patient with MMC has a shunt complication early on, this study suggests it plays a major role in the early life morbidity they mention.
It's a sobering reminder. The 22-year single-center experience allowed them to see these patterns clearly. When you look at the association between hydrocephalus and survival, it's not just about the presence of the fluid, it's about the surgical burden of managing it.
And for the medical students listening, it's important to remember that MMC isn't just about the spinal defect. The Arnold-Chiari malformation and the resulting hydrocephalus are often what dictate the long-term, and as this paper shows, the short-term survival.
The paper really emphasizes that defining these mortality patterns is key to improving outcomes. If we can identify the specific shunt-related complications that lead to the highest risk, we can tailor our surveillance and intervention strategies.
It's about being proactive rather than reactive. If the study shows a strong association between early shunt failure and mortality, it reinforces why we are so vigilant in the neonatal intensive care unit and during those first few follow-up visits.
Precisely. The authors conclude that by examining these associations within a long-term institutional cohort, we get a much clearer picture of the risks these children face. It's a call to refine how we define and track hydrocephalus-associated deaths.
It's a vital piece of work for the field. It moves us away from generalities and towards specific, data-driven understanding of MMC mortality. For our residents, the takeaway is clear. The management of hydrocephalus is not just a secondary concern. It is a primary determinant of survival in the MMC population.
Well said, Dr. Eris. It's a reminder that every shunt revision and every intracranial pressure check is part of a much larger picture of early life survival.
That's all the time we have for today. Thank you for joining us on the Neurosurgery Hub podcast.
We'll see you next time.